Hello everyone, I hope that you're doing well and you're succeeding in your careers, you're doing your steps, you're doing whatever you are doing for your career. However, today's topic is a bit not for medical students. It's more, and even if you're a senior medical student, I feel this is going to be helpful for you, but it's most helpful for residents, specifically junior residents or those individuals who are just starting their residency career. When I started residency, I was in a shock where I felt that everything I have learned through the steps is helping me have an approach. I think in the clinics it's really helpful. But once you are spending your time in the wards and in the ED, beyond history taking and building a differential, when it comes to managing individuals and getting into the nitty details of diagnoses, I find that I'm lacking, and that's very expected. And that's why we have a residency. So you end up having all of these details in your mind. So it's very expected from the best of the best to have this. So me or others are going to experience this when they go into residency. However, I was thinking to myself, what would be an optimal way to establish a very good retention of the knowledge that I'm acquiring during residency? So one way is going to be seeing as much patients as possible, because the more cases of celiac disease, alcohol withdrawal, an overdose that you see, the more you will become experienced with the management and also with the details and the labs that you will send and so on and so forth. And that's very important, and it should be there. The other thing I thought of that could go hand in hand with that, and also with my study of the topics that I tend to see during residency, is Anki. So I continued to use Anki, and with time, I felt that it's really helping me to retain important information, and not just for the theoretical aspect of it, that I feel that I'm not forgetting stuff, and not just for impressing senior colleagues who might have a say in your fellowship in the future if you are interested in a specific program or a fellowship program or something like that, but also I felt in terms of my patient interactions, because I feel that I know more, and not in front of a patient I start thinking, what was that that I forgot already. So I feel it's better for memory retention. I wouldn't say that it is essential, so please, it's not essential. It's just, if you are someone who has been using Anki, if you are someone who loves Anki, I feel you should not discontinue using it during residency, and you should continue. And the purpose of this video is to guide you on how you could use Anki efficiently and in the best way, so you could retain the information during residency. And I'm going to show some examples. So that's the Anki logo. So why use it again? Retention, efficiency. I feel it saves time. So for example, if you go through the guidelines, which I will show as an example, the 2024 European Society of Cardiology guidelines on AFib, and you go through them once, and let's say you study them really very well, and you are in your cardiology rotation as an internal medicine resident, or even as a pediatric resident, or an emergency doctor, whatever it is, and you end up seeing as many as possible AFib patients, but then you will disappear from cardiology for 2 years or 1 year and a half, or maybe till the end of your residency. Well, you will tell me that if I'm interested in cardiology, I will go into a cardiology fellowship and I will be seeing AFib every day. Correct. What I think of is how, to be a very well-rounded physician, and also for you to make your fellowship easier, and even your internal medicine journey easier, because things will disappear and then appear again. At least for now. I will definitely reflect on my journey later, but I feel that Anki is going to be helpful. And if people have used it before, and they can share their experience in the comments, that would be much appreciated. So I feel it makes it efficient, because going through a 90-page sepsis guideline is really hard every time you want to revise the topic and the recommendations. However, if you have it on Anki and you have the spaced repetition, you will master the guideline, you will know everything about it, and whatever piece or detail or dose or recommendation that you keep on missing will keep on showing in front of you repeatedly. So a basic refresher of Anki, I have a full video that will show at this moment on the screen, I don't know in which corner, about Anki settings and detailed Anki use. So if you are someone who's new to Anki, please see that video. It will guide you on the basics of Anki, which I'm not planning to talk about in today's video. However, the card types that you will be seeing me using in Anki are going to be basic, which is basically front and back, and close deletion and image occlusion. And I will show you examples of these. These are the three types I feel are the best to use during Residency. There are the main three types in Anki either way. And in Anki, you have the concept of decks, which is basically a collection of cards. So I will show you how this is important as well. The customization of intervals and this whole story on how you make the hard question appear tomorrow and the easy question appear in 5 days. It's fully detailed. The whole settings I'm using are the ones that Anki posted on YouTube, and they are present in the video that I just showed you. So you can visit that video if you want to put the settings and copy them. And lastly, the ability to sync across devices. As someone who rides public transport, I get the chance to do Anki while I'm there. If you are in the gym running on a treadmill or a cross machine, you get to use your Anki and do your daily Anki. So it's really, it can be done anywhere, and you could sync it. So whatever progress you have made on your phone is going to show up on your laptop and so on. So these are examples of cards that I'm using, at least, and I have made it during Residency. So for example, there is the nephro and ototoxins. I feel that I'm only keeping things that I feel are clinically relevant, things that one day I might be asked about, again, by a senior or by a patient, most importantly. And the other thing is, I'm not focusing too much on basics and pathophysiology of things unless it's a topic I'm really in love with and I would like to learn the pathophysiology and keep it in my mind and not forget it as I progress in my career. So that's an optional thing. However, what I feel I want to capture most is the clinical vignettes. If you are someone who has done very well in your step 2 and you feel that the approach, so for example, what labs do you order in someone with a picture of normocytic anemia with high retic count, so that looks hemolytic. So you know that you will order the LDH, the haptoglobin, the direct comps test, cross match. So if you have this approach already in your mind very solidified, I don't feel that you have to make an Anki for it, because it's all about efficiency. You don't want to, as I'll show you in a bit in resources, you don't want to grab a book and put every single sentence from the book in an Anki card. That's inefficient. So the things that you feel are relevant to you. For example, let's say that you're someone who's very good that you already know this, how baclofen is used in alcohol use disorder. So if you already know this, there is no meaning, especially this is in individuals with alcohol-related liver disease, with alcohol use disorder. So baclofen is the first line in these individuals, and that's something I never heard about before reading the American College of Gastroenterology guidelines. So if you are someone who knew this already, and you know how doses are started and escalated, then there is no meaning of adding the card. Like if you feel this is a solid fact in your mind, there is no meaning of making this card. I didn't feel so. And that's what we mean by closed card. Again, in the video, I describe them really very well. And that's another example of a closed card. So which medications are both nephro and ototoxic, cisplatin and fotresin, and those others are the nephro or ototoxic alone. And then eventually, this is the front and back that I talked about. So it's basically showing you a question without filling the space, like here. So this card, when it shows you, this is going to be empty, this is empty, this is empty, this is empty, and this is empty, and you need to guess them. While in this card, it will only show you the question, and after you press on space on your keyboard, you will be shown the answer. So that would be more than 12 months of symptoms despite a gluten-free diet. So these are examples of cards I feel I have made during Residency, and there is more and more and more. These are just examples. And you could also use the image occlusion add-on, which I have mentioned in that video, to hide things. So for example, this is a table of the medications used in acute simple cystitis in non-pregnant adults. So trimethoprim fluticasone for 3 days, that's a very common prescription. However, I have missed the fact that it's twice daily, that we give the 160-800 dose twice daily. So I have occluded this with the image occlusion, as well as the duration, because I have always thought it's 3 days, regardless of male or female. So you see, I can hide this, I can hide this, and I can hide this, and I can hide the dose. And now I have 4 different cards that will question me on the dosing of Bactrim in UTI, in simple UTI. And you can apply that all throughout with the image occlusion really fast and create maybe 20 cards out of this table. Similarly, when you have a large algorithm, for example, the management of DKA or HHS, and there is these different decisions that you have to take based on potassium readings, on glucose, you can easily do this and use the image occlusion on algorithms as well. There is also pre-made decks, less commonly in residency, it's less often. However, like for step 2 and for medical school, it's comprehensive. For residency, it's not. However, for example, there is this one on ECGs, and I hear it's really very good, and the name tells you so. I have never used it. I plan to use it sometime in the future. Yeah. So my advice would be to identify a high quality resource, be it a book, a guideline, an article on a certain topic that you are interested in learning, maybe because it's your next rotation, maybe you are doing that rotation currently, maybe you are interested in the topic, maybe because it's a topic you would like to learn, it's part of your residency curriculum, or whatever residency you're doing, and it's not just internal medicine. You're doing pediatrics, emergency medicine, surgical specialties, I don't know, judge by yourself. I don't know how your residency is. I don't know if you memorize anything other than soft skills, like on your hands, that you need to learn. So judge by yourself. I don't know. So there is many books. Harrison's, obviously it's massive. However, you don't need to learn every single word. You don't need to memorize every epidemiological fact. I mean, rarely you will have to. So you have to be efficient. That's my advice. People tend to get excited about starting new things, so they will go on and try to learn every single word about the prevalence of HIV-2 in a certain country in West Africa, and they will never go there. So pay attention to what you are learning. At the end, you have limited time and limited effort. So try to spend it on the most useful information to make you a better physician. There is also the Greenberger's series, and I really love it because they have for every specific system. These are for internal medicine. Obviously, there is an Harrison's for pediatrics, for infectious diseases, if you're a fellow, for all the different subspecialties. And Greenberg's, there is also for neurology, for cardiology, emergency medicine. This is for like wards and internal medicine, the MGH House Staff Manual, even for emergency. And there is the Oxford Handbook for Emergency. Everyone knows their specialty. You can easily Google and find out books. You can go to Reddit and you'll find people discussing them. You can find the resource. It's not hard. And then you use ChatGPT. So this will make you further more efficient, because making the cards alone, as someone who's experienced in Anki, it doesn't take me much time, but still, when I use Anki, it saves me time. So imagine if someone is not experienced and not an Anki addict, it's going to take them a lot of time. And obviously with the premium, you get unlimited use, and also you have the new O1, which is really amazing and can make a lot of cards, really a lot of cards. I have recently tried it on a guideline related to celiac disease, and it managed to make me cards for the whole guideline. And when I used the cards, they were really good, similar to the ones I make. And I didn't make a single card out of it. It was a very small guideline. There's no medications, as you know, it's celiac disease. So, I mean, that's probably something that have made it easier for chat to make at once. However, for other topics, I feel you have to feed it one paragraph by paragraph, and sometimes you have to give a good prompt or instruction on how do you want them to make the cards, what to focus on. It's AI, so you have to get used to using it. And now I'm going to show you an example. So this is from the Greenberg's book of gastroenterology, and on the chapter of complications of cirrhosis, including hepatic encephalopathy and ascites. So I skipped parts that could be boring. However, I will go through them, and if I find something that I need, I'm going to make an Anki for. However, in this sentence or paragraph, they are talking about tense ascites, and here they mention the dosing of albumin. After the removal of more than 5 liters of ascites, you give 8 grams of 25% albumin for every liter removed beyond 5 liters, with typically no more than 10 liters removed at one time. And you have to sell cell counts to rule out spontaneous bacterial peritonitis, even if someone is asymptomatic. And that's when tips should be considered. The tips of procedure if someone has a low mildew score, so it's not a very decompensated state. Low bilirubin, good cardiac function, minimal hepatic encephalopathy, no liver lesions. So you can see there's many different information. So I'm going to copy it from here. Actually, there might be also something useful here. So I will copy this whole thing. And then I will head to ChatGPT. And I will ask it to make me front and back cards for this paragraph. Now, before I make ChatGPT do it, let me take you to Anki. And I have created a deck with the name of the book. So here it is. And then a subdeck with the name of the chapter. So here it is, complications of cirrhosis and ascites. I press on it, I add, and now I can add a card to it. The type of the card is basic because it will have a front and back. And now let's ask Chat to make it. And you can always evaluate, right? So I really didn't like this. He put all of the management in one single card. That's not what I wanted. So he didn't understand. I want many cards that are focused. So I said many. I don't want him to go on and ask about every single word. So that's why I added focused, so he doesn't make it stupid, right? So management of tense ascites, perform large volume paracentesis, follow with diuresis and a low salt diet to prevent recurrence. What's the management of refractory ascites caused by diuretic resistance or intolerance? Large volume paracentesis again. So this is a very nice question. Obviously, not every card that ChatGPT makes you should copy and add to your deck. It's up to you. That's the nice thing. And you are efficient. So how much albumin you should give? I really love it. That's amazing. So I will add this card. I will copy this here. I will remove this word and I will add it. So when I study how much albumin should be administered during paracentesis, very lovely question. I think it's 8 grams of 25% for every liter after 5 liters, with no more than 10 liters removed. That's very good. So you can see you have already memorized it. So these are the intervals I was talking about, which again, watch that video. So I will use easy. This was easy. So he will show it to me in 4 days, while an information that was difficult will be shown to me tomorrow, so I can consolidate that knowledge and make it easy with time. You go beyond. For example, this feels very solid in your mind that cell counts should be ordered to rule out spontaneous bacterial peritonitis. There is no reason for me to add it. However, what are the indications for tips in refractory ascites? I could add this. I could edit it a bit, like what are the indications? It's not the indication, but maybe what are the conditions? Like, you must fulfill all of these. If someone has a low mildew score, but their ejection fraction is very low, and they have right heart failure, actually right heart failure is a contraindication. So you can edit it out. It's not something, this is not like a holy book, right? And here's an example of a guideline. So you search for the most recent European Society of Cardiology guidelines on atrial fibrillation. They are the 2024. And you can easily scroll down to the recommendations. So patient pathways, let me go down. So a lot of stuff that is important, but you can't make an Anki card of. So shared decision making, multidisciplinary team, don't make an Anki card out of this, right? It's all about efficiency. That's what I say. There are two people in this world, people who love Anki, people who don't. And the only difference between them is that people who don't want to learn how to use Anki. If they learned how to use Anki, they would have loved it. So this looks like a nice algorithm. You could copy it, hide the stuff if you feel so. Obviously, you have to give it a read. I'm being fast here. So that's really very lovely. So if someone is not stable, you do electrical cardioversion. If someone is stable, I really love it. So that's with first diagnosis of AFib. Someone came to your ED with AFib. So I will make a deck here. I will call it European Society of Cardiology, ESC, and then I will add 2024 AFib, because they have different years. Obviously you want the most recent, but there is things that haven't been updated. So when adding the card, make sure that the deck is chosen correctly. So it will be added to the 2024 AFib, and I will use the image occlusion add-on. I've already copied the image. So what will you do if someone is unstable? Cardioversion. If someone is stable, what's my first step? To see the rate. After that, the ejection fraction is less than 40%, and so on and so forth. So I will just hide things, and so on and so forth. Then choose that. If you choose hide one, guess one, that means they will only hide this when they ask you about it. If you choose hide all, guess one, they will hide everything, but they will be asking you about this. It will show up in pink, and you will have to guess it. So you do this when you feel that if they show you the other things, it will make you know it, and you want to challenge yourself. So up to you, obviously. And you go on and add them and start studying them. So with that, you will not be using ChatGPT. However, this is another algorithm. It's really very lovely. I really love it. I will definitely be studying this guideline. AFib is very important. It happens very commonly. I see it a lot. I'm not studying it yet. So I will definitely, when it comes to the topic, I will study these. And then you go down evidence tables. I'm trying to look for something like for anticoagulation, like a dosing or something. So if I search apixaban, so apixaban. So direct oral anticoagulants, here's the chapter on them. So you go down, here is the dosing. Open a new tab, and now you have this table. You can easily use like this tool, Flame Shot, on your laptop. You can find another one if it doesn't work on your type of laptop or software. And I'm taking a screenshot, I'm taking it to Anki, and now I'm taking that image and hiding the 5 milligram twice daily of apixaban, the 150 of dabigatran, the 60 daily of edoxaban, and the 20 daily of rivaroxaban. So dose reduction, you have these three criteria that you need to out of. I can hide it. What will be the reduced dose? I can hide it, and so on and so forth. It's really very lovely. It's really very lovely, and it's a great way to memorize and recall these pieces of information. So that was it. I hope you liked the video. I hope that was comprehensive in providing the rationale and also a practical approach to how to use Anki during residency. Again, I strongly recommend that you think about it. You see your type of specialty, because it differs from one to another. However, I feel in internal medicine, and specifically if you have a fellowship that you are looking for and you want to build that knowledge, and even as a generalist, I don't know. I feel it's amazing. I feel it's the best tool to retain information, and then you go on and see more patients and more patients. So you have both of these hands on hands. You are going to study the books. You are going to open the guidelines. What you do when you use Anki is that you will have to open the guideline once, and then you will keep opening that guideline indirectly in a very smooth way that's very efficient, that's very directed, not a large guideline, only the things that really matter for you every day, and master it. So it's really efficient, it's time saving. You don't think of it as time consuming. You don't have to Google and download these guidelines every time you want to read about AFib. You have it on your phone, and even if you want to search for something, you can use it for searching. So that will be the last thing, I promise. So you can use the browse function. So if I'm looking for albumin in ascites, even on the phone I can do this. I can search for albumin and it will show me this. So okay, now I recall it. So it's similar to Google, because now you have all of this knowledge here concentrated on your Anki, on your phone and on your laptop. So easily I found this, and then easily I can add the rate of albumin with 1 ml per minute or 1 milligram per minute, something like that. So you can easily add them. And why is it like this? Because of the risk of pulmonary edema. And you can add all of these cards on your phone, and it's easily accessible. So not just for solving, but even for if you are looking for a piece of information. So I hope you like this video. I hope you become part of the Anki gang. Thank you for watching. See you in the next one. Bye bye.